Men with chronic pelvic pain or prostatitis, this video is for you. If you've gone to see a urologist, the pain hasn't gone away, maybe you've been prescribed antibiotics, maybe you've just been living with this for a really long time, you don't know if it's ever going to go away, this video is going to talk about the common causes of that and how to ultimately fix that. So be sure to watch the full video. I have brought in Lance Frank. He is a physical therapist and pelvic floor specialist. This is what he treats on a daily basis. So right now, I'm going to turn it over to him, and he's going to help you out.
The first thing you need to know about chronic pelvic pain or prostatitis is that usually when people go to the urologist, they get tested for some sort of infection or a prostate infection or an STD, and they get put on, automatically they'll get put on rounds and rounds of antibiotics or steroids, and symptoms might start to get better at first, but then over time they start to gradually reappear as your body becomes resistant to the antibiotics. And so people get stuck in this negative loop of being prescribed antibiotics, pain comes back, being prescribed more antibiotics, and so it's just this vicious cycle. And so a lot of people don't know that the pelvic floor is even involved and potentially involved in some of these pain symptoms, and so they just get kind of stuck in this hamster wheel.
Got it. So it's that urologists don't recognize that the pelvic floor is part of the issue, or why are so many people getting it wrong?
So unfortunately, a lot of the medical community still doesn't recognize the pelvic floor as being involved in some of these diagnoses. And so sometimes it's a lack of education, and sometimes it's not fully understanding the pelvic floor's role in these symptoms and how they can be involved.
Got it. So for people who have gone to a urologist who have had a similar experience to this, they've gone through the antibiotics, they haven't figured out the source of the pain, how do we know if it's a pelvic floor related issue?
Usually pain doesn't just exist in isolation. A lot of times people that have this chronic pelvic pain or this perineal pain will have pain in other areas too, like their penis or their testicles. They might also have other urinary symptoms like pain with urination or urgency or frequency, and they might also have bowel issues like painful bowel movements or constipation or even frequent hemorrhoids.
Got it. Is there a way that people can test for pain on their own? Like, how would they go about that assessment?
Well, generally people that have pain have it on a consistent, constant basis. So something is generally hurting all the time. But people can also kind of do like a self-assessment or palpation assessment to feel areas of the parts of the body that whenever they're pressed might also elicit some kind of painful response.
Got it. So I should literally just
Start feeling around all around the abdomen, the groin, the perineum underneath the testicles, between the anus, the inner thighs, the glutes. All of those areas are fair game that might have issues involved with the perineal pain or the prostatitis pain that people are feeling.
Okay. And then if we do find a point that is really painful, what should we do then?
Well, first, just like with any painful muscle that you might experience, a gentle massage can be helpful. Doing a perineal massage, most people have some sort of perineal pain, and so, patients will tell me that it feels like I'm just sitting on a golf ball. It feels really tight in between my testicles and my anus. So doing a gentle perineal massage with like a tennis ball or a lacrosse ball might also be helpful. And just general flexibility and freeing up the tissues and getting more length in the tissues around that attach into the pelvis and in the hips is also part of programming for people that come in to see me with prostatitis.
Got it. Are there any other strategies or any other information or tips that people should know about when it comes to chronic pelvic pain?
So stress management is also huge. People that have chronic pelvic pain or prostatitis generally have what's called an overactive pelvic floor. So they just are walking around with a clenched pelvic floor all day or a tight ass. And so learning how the high stress, high anxious, the type A overachiever type are generally fall into that category, and learning how to cope and manage with the stress that's happening in your life is a big part of what I do with people in the clinic when they come in with these symptoms.
Got it. So it sounds like people with chronic pelvic pain, they're not older people.
Generally, no. Usually it's the younger population, anywhere from 20, 30, 40s, sometimes 50s, but generally the younger demographic is the most affected.
And I would assume that most people, if they're younger and they're having that pain, think that like it's really weird and that they're too young to be experiencing that pain, or like what do they think?
Right. No, a lot of people will have this pain for sometimes years. I had a patient that had this pain for over 10 years before anybody recommended pelvic floor therapy.
Wow.
And so sometimes people just kind of suffer in silence. They think they're the only people that experience this. There's a lot of shame associated with it. People don't want to talk about it with their friends or their peers.
Yeah.
And so people do a lot of Googling or a lot of just suffering in silence.
Got it. And that can lead them to, if they try to find out the issue on their own, is that what are some bad things that can happen, I guess?
Well, some bad things, there's a lot of information on the internet, and sometimes if you're doing the wrong kind of treatment or programming for your symptoms, it can actually make your symptoms worse. So the biggest example is just doing a bunch of Kegels over and over and over again. A lot of people will think, well, maybe it's just my pelvic floor is too weak, so I need to strengthen it. And then they'll just be doing 1,000 Kegels every single day. And that's going to completely exacerbate all of these prostatitis symptoms that they're already feeling.
Got it. So what should they be doing instead?
Learning how to relax the pelvic floor, learning just basic relaxation techniques, whether that's meditation or yoga, or with my pelvic floor patients, we do a lot of breathing techniques with relaxation and releasing tension in the pelvis, combined with just general flexibility and mobility routines to help free up tension in various parts of the body.
Got it. And since most people probably can't go see you at your clinic in ATL, we actually created a 10-minute workout for you guys to work on relaxing an overactive pelvic floor. So when this video is finished, click on the link in the description below. You can follow along to that video. How often should they be doing that?
At least once a day, ideally twice a day, every single day for the first several weeks. Generally, a typical program in the clinic that I give patients is 6 to 8 weeks.
Okay. And will they notice the improvements or the results?
If you're going to improve, you should notice improvements within the first few weeks after doing this routine consistently.
Cool. All right. So there you go, guys. Click the link in the description below. Do that workout every day. Once a day? Twice a day?
Let's shoot for twice a day.
Twice a day, beginning, morning, and evening, and then do that for 6 to 8 weeks. Hopefully you'll notice the improvements. And if you like this video, again, please like this video. Click the like button, leave a comment if you have some feedback or another question. Subscribe, don't miss out on these videos. We've got more videos in our pelvic floor series coming out. And make sure to follow Lance for more pelvic floor related information.
You can find me on YouTube, TikTok, Instagram, all at Lance in Your Pants, or you can check out my website, flexptatl.com.
Cool. All right, guys, thanks for watching. If you haven't clicked that video yet, it's right here. Click it, add it to your bookmarks, add it to your favorites, whatever you do. Make sure you do it daily, and hopefully 6 to 8 weeks, you'll be feeling a lot better. Thanks for watching. We'll see you guys on that video.